Well, hello, everyone. I'm so excited to have somebody here today that actually works in a very fascinating field. And I'm sure we're going to learn lots of great tips and information about it. And it all comes about at some point in our life. So I want everyone to welcome Eduardo Guimbarda with HNTS. Welcome.
Thank you, Missy. Thank you for having me, and look forward to the conversation.
Wonderful. Well, I know I said it was HNTS, which was much easier for me to get the mouthful out, but please tell us what that means.
So HNTS, we're a home healthcare business, and HNTS is an acronym for the original name of the business back from 1982, Home Nursing and Therapy Services. So HNTS is just simply an acronym for Home Nursing and Therapy Services.
And way faster to say on the phone.
That's right.
Yes, sir. So tell us a little bit about how you got started in this business and about your business.
So my passion for healthcare stems from many years ago as a child. My father is a physician or was a physician. He now is in heaven. But my father was a physician, and I was always intrigued by the difference he made in people's lives and how he was able to get people through complex situations that otherwise they wouldn't be able to get themselves through. And I was always attracted to that side of my father's practice. And so healthcare seemed to be the right fit for me in my future. So that's where I started my love of healthcare. Then I wanted to follow in my father's footsteps and become a physician. And as I was waiting to try to get into medical school, I started a graduate program in my master's in business and working in the healthcare field. Started doing business development in healthcare and became more and more involved with the healthcare company itself and learned a little bit more. And before you knew it, I was doing more administrative functions and operating functions. And then I became part of owning a home care company. And so excited about maybe not being a physician. That was my original passion, but indirectly we still get to change lives and improve people's lives indirectly through our home care business.
Absolutely, you do. And not so many more years of school.
That's right.
Just looked at it in a different way, and you're still in a very giving position. Often in business, we have people ask us, "Is this your passion?"
Right. Right. You know, there's a lot of things that are good in everything that we do and
Mhm.
difficult in the things that we do. And I have to say that there's some the positives definitely outweigh the negatives in what we
Mm.
do on a daily basis. If we take the perspective of the changes that we make with families and patients we
Mhm.
serve, we get to forget about and have short-term memory on the difficult things that are complex with the healthcare industry itself.
Yes, absolutely. So why don't you break down for us exactly what you do in your business and how you help people?
So in the home healthcare world, we start with receiving patients from hospital systems or inpatient facilities that have graduated from that facility and are being discharged back into their home. Over the 33 years of experience of serving these kinds of patients, we've learned that the importance of that coordination of care, and what we used to think was our care starts when we do the admission in the home, and actually our care begins when they're still in the hospital preparing for that discharge, preparing for all the things that are going to be needed. It is extremely important that we're very prepared to receive the patient in the home so we don't have any kind of situations that may create an exacerbation of the sickness and end up back in the hospital system. So what we do is receive the patients from the hospital and then provide the full service of skilled care, skilled nursing care, physical therapy, occupational therapy, speech therapy, and those kinds of disciplines for the patient to transition from an inpatient setting to their home setting and to hopefully independence after that.
You know, I liked what you had to say because I think that's really important when we talk about somebody that's had issues and they're hospitalized and then they're gonna come home and they're gonna need help, that it starts before you get home because being disorganized coming out of that setting and then into your home is not a fun place to be for anyone involved, including the patient. So I think that's an awesome statement that you made and, helps in that transition, besides really adds a lot of peace to the person coming home and to the members of the family that need to deal with them as well.
That's correct. Yes. Yes.
What are some of the key things that you think is important, for someone when they're choosing who they're gonna use and need your services?
I think it's extremely important that they feel comfortable and have a provider similar to HNTS that understands the importance of that transition of care and that coordination of care prior to the discharge, to select an organization that may have many insurance companies that could potentially benefit every patient that's coming out of the hospital. There are a lot of complex areas. Insurances are different, limitations within access to care, limitations within the benefits of what the insurance provides. And so the patient and the family are already sick, tired, frustrated, and all they want to do is go home and feel better. And it's extremely important that they select an organization that can handle all of that coordination well so that they can focus on getting better, not spend energy on battling authorizations, battling limitations of benefits, battling some of the realities that we all have to battle with insurance coverage.
Right. Tell us all actually a little bit about how you hire people and what's important to you when you send somebody to, help a patient.
Well, we hire many different types of people within our
Mhm.
organization. We have clinical direct staff, and then we have back office support staff, and all extremely important to the overall delivery of the care. But from a clinical standpoint, I guess from any standpoint, the who philosophy in hiring that right person is extremely important when we are vetting out that next candidate for our organization. From a clinical standpoint, we want someone with compassion. We want someone with expertise. We want someone that's willing to educate. There are a lot of healthcare providers that are great healthcare providers, but not very good educators. And in our world, it's extremely important to lead someone to independence and to be able to care for themselves, especially those that have comorbidities and different types of diseases going on at the same time, that we educate family members and the patients themselves to be able to make them independent or at least as close to independence and free from any kind of healthcare involvement or hospital involvement. So compassion, expertise, and education, I think, are the three big values that I would say when it comes to the clinical side. And then there's the office side that, people that are attentive to detail. We miss an authorization or an eligibility, or
Yeah.
we don't dot our I's and cross our T's. We provide great service, but the organization itself may not be sustainable because we can't collect our money from the insurance companies. So it depends on who we're hiring, but in the end, servant leaders, compassionate people, because we all somehow, some way touch the patient or call the patient, and we want to make sure that our patients are always feeling like we're advocates for them. We're helping them through this very difficult journey and getting them to independence.
And, I like the fact that you talked about education because many times people just get told to do something. They don't know why they're doing it. They don't understand it. And that doesn't help everyone. And so I think adding that piece into it is a wonderful thing to offer because, again, it just elevates that experience. And it also de stresses because you don't have all these questions or find out you've been doing something wrong. And that's even more stressful.
That's right. And Missy, let's face it, there's many times where people are going through that hospital journey, even family members that are seeing it indirectly. They get great discharge instructions and great discharge plans. They get home and said, "What did they tell me?" or "What is going on?" And so the complement of our services and that education is a huge, huge role for us.
What do you think is critical, once you have a client at home that the family needs to, think through, be aware of, number 1? And then number 2, what's the most important part for the patient to really focus on as well?
So from a family standpoint, being able to be a wonderful support for your mom or your dad or
Mhm.
what whoever family member has happened to be sick, to be there to assist in maybe going and getting medications or being able to ensure that follow-up appointments are scheduled and accurate and correct, and making sure that we have good transportation for that patient to get them to that follow-up
Mhm.
visit. Uh, Too often, we find patients that they're just tired of being sick, and the last thing you want to do is go to another physician visit. But it's extremely important that we meet those milestones to be able to get them to graduate. For patients, I think it's a mindset. Once again, they're tired. And it's not that they don't want to be compliant, it's just they're just tired. And keeping that motivation, keeping pain levels in control with medications at the right time. Someone doesn't want to do therapy when they're in pain. So managing pain is extremely important for us. And so uh, being able to have that mindset of wanting to be better. I've always stated that our patients that are going through a post surgical hip replacement or knee replacement are our best patients because someone's motivated to go get a new knee or a new hip because they want to go dance again or they want to get into that low sports car again or do the things that they were doing prior to that arthritis plaguing them and them having to be going to a total hip replacement or a total knee replacement. Some of the people that have chronic comorbidities that just continue to have problems with them or don't understand how to manage them well lose hope. They get tired, and so
Yeah.
keeping them motivating and keeping them with a healthy mindset to get them to feel like there's light at the end of the tunnel is also extremely important for us in what we do for these patients.
Absolutely. I'm sure, with your staff, that's one of the hardest challenges that they have,
That's right.
in dealing with them, but that's part of their job.
That's right.
That's right. So, what is the least amount of service that you offer, and what is the fullest extent of services you offer?
So we offer everything from, like I was stating early, coordination of care, patient advocacy, have them understand the complex healthcare insurance environment,
Mhm.
having to understand now more consumers are stuck with a higher patient responsibility, higher deductibles, higher coinsurances. And so not understanding what's going to be actually coming out of pocket could be a shocker at the end. They need the care, but when they get bills and statements to pay for that care, it could be a shocker. So, um, but we provide those services as well: the advocacy services, the direct clinical care, the transition of care. We send physician assistants to hospital systems to be able to see patients prior to their discharge. What we don't do for patients are maybe some limitations that maybe an insurance company provides with let's just say traditional Medicare provides
Mhm.
X level of benefit, and another insurance company may not. So are what we don't do is because of a limitation of maybe a benefit in an insurance company or the safety of the patient. Give you another example: first dose antibiotics. When we're infusing antibiotics with a high level infection, we don't do first doses in the home for risk of an allergic reaction.
Right.
So that's maybe an example of the services we may not provide. We can do infusions in the home, but we'd like that patient that's never received that antibiotic to receive them in a hospital setting in case they have an anaphylactic reaction to that antibiotic that they've never taken. Trying to think what other services we may not provide. Hospice services we don't
Mhm.
currently provide right now, but we have a lot of partners with hospice that we can help our patients with. Um, uh, I think that's about it. I don't know what other
Mhm.
services we may not provide. I'd like to be able to provide long-term care services, and maybe that's a good example, and a good example where there's a limitation. Long-term care services, provider assistance services, is not necessarily the skilled side, the nursing, the therapy. It's helping with the social determinants of health, the bathing, the grooming, the
Right.
feeding, the making sure medications are in front to take and the calendars there in front. And most commercial insurances and Medicare do not provide that benefit for seniors today. And I think the population in general does not realize that provider assistance services are either going to be privately paid or available for the underserved Medicaid population where the Medicaid insurance covers that. There's also one more area is long-term care insurance. Long-term care insurance policies is a good way to prepare yourself for those kinds of costs that you may need in the home. But those provider assistance services we'd like to give to everybody because we believe focusing on the social determinants of health, making sure somebody has a good meal, bathe, groom, fed, have access to the medications are sometimes more important than that nurse or therapist going out there, and it keeps the patient stable and able to receive these other services.
Eduardo, who decides whether they get in-home care or hospital care?
So usually doctors and hospital systems are the ones that make the decision on the next steps or the graduated steps from being an inpatient to needing home care services. Now, a physician can refer a patient directly from his or her office to receive home care service in preparation for maybe a total knee replacement or a hip replacement or as a preventative measure that I not feeling well and before that the vitals get unstable, let's see if we can't send a nurse out to your home to see what we can do to prevent a hospitalization. But it's a physician that orders the care. And then the patient, the consumer, the physician has recommendations. The hospital discharge planners have recommendations as to which agencies are best suited to provide the care for the patient at the next level. But to get home care services, we need a physician to order the service and sign for the care.
Got it.
Is it in the best interest of the patient to get in-home health, or is it better for the hospital systems to take care of that? I'm wondering if there's a conflict of interest between what's the best for the patient and what the, let's say, insurance companies want.
So th- we have a three-prong system where we have different stakeholders. We have an ordering physician that is ordering a service that's paid out of a different pocketbook, which is the insurance company. And then the receiving end, the patient, the consumer, is getting the care of those services. And so obviously there could be interests that become to get conflicted in that type of scenario. But what we have is that there are services that are better served for a patient in home. Now, obviously, we can't care for difficult, complex patients that need to be in a hospital system, but there are many services that are now being done in the home that don't have to be done in a hospital system. And so we have studies, there are many studies out in the US that the environment that you're treated in is a variable and part of the significance of the outcome. We get to a clinical outcome much quicker if the patient is in an environment where they feel safer, they feel more comfortable, where they are exposed to less infection because hospitals are full of infections. And so the question of is it better to receive care in the home or in the hospital, depending on the situation and the gravity of the illness, as well as if you can get the service in the home, it is preferred to get the service in the home rather than being stuck in the hospital
I
getting
know
care.
I would want to be in my home. Much more comfortable. I like the sounds better, the smells better, all of those things are better being in a home.
That's right.
So I can definitely see that as being a benefit.
Is it something the patient should be asking for? Should they be asking their doctor to say, "Hey, let's send someone to my home," versus I don't want to go to the hospital? Can they influence?
Absolutely. The consumer has every opportunity to ask the physician. As a matter of fact, we're well aware that when we're watching TV, we see all of the advertising for the pharmaceutical companies. And that's what those advertisements there are for, is for you, the consumer, to be able to go back to your doctor and say, I want to know more about Ozempic, or I want to know more about how I can utilize Ozempic to treat my obesity. Yes, healthcare is still a consumer-driven
Right.
service. As a matter of fact, I'm of the philosophy that healthcare is more of a right rather than a privilege, but that's a different conversation to have. As a consumer and as a patient, you should be able to ask your physician, is this something that maybe I can avoid a hospitalization and get a nurse to come treat me in the home?
Correct. And would you not say also, for those that are a little bit more savvy, just because that's who the doctor recommended, if you have a preference and have done your research, can you ask for that company instead?
Absolutely. It's patient choice anywhere and everywhere you go. And
Excellent.
so there's not a healthcare provider that can't tell you. Now, obviously, you have a trusted physician, and if your physician sends you to a cardiologist of his or her choice, you're going to consider, but you always have the right for a second opinion, or,
Mhm.
hey, my cousin is a cardiologist and I'd like to go see him or her. And so just like that, we can pick the home care company, and as long as it fits within the network of the insurance company that
Right,
you're under.
right. You said something earlier that I keyed in on because often, we're excited to have the help. We're excited that insurance approved it, and we have often a mentality that that means it's all taken care of. And you made a statement earlier about then they get the bill afterwards of what's their portion, and it's often a shocker. And one of the things you talked about is you guys do counseling. Can you tell us a little bit more about how you help your clients with that so they're prepared and not sitting there going, "Oh my gosh, nobody told me about this."
So, Missy, this is where it gets a little complex. And what we do is we tell them from a point in time, there's technology where we run eligibility on a
Mhm,
patient that'll tell you complete coverage, what amount of the deductibles they have met along the way from that time period.
mhm.
But let me give you an example. You have a patient that went into the hospital that gets discharged from the hospital yesterday. I run eligibility yesterday. And yesterday, they're just being discharged from the hospital, and that hospital hasn't even run their bill yet.
Right.
And so there's gaps in that knowledge of understanding. We do our best trying to give them a point in time picture of where you
Mhm.
stand, of where you've met your deductible. But also, our politicians in Congress have pushed for providers to now be compliant with, and there's hefty fines out there that as a consumer, if there's not any cost transparency, we shouldn't be providing a service to anybody in this community or to any patient without that healthcare provider giving you that best point of time picture and
Mhm.
let them know what's the potential out-of-pocket expense. And
Right.
that's called the cost transparency rule that recently came out, where consumers must be aware of the services they're providing. That rule is twofold. When we didn't have to pay anything out of pocket as a consumer, it didn't matter what healthcare services were ordered. And in fairness to the insurance payer, there was no accountability. Healthcare services were being ordered. Consumers don't care. They just want to get the care that the doctor ordered.
Right.
But was it truly necessary? Did I get an MRI a week ago at one facility and they're running another MRI 2 weeks later because they don't have access to that MRI? And so when we drive more cost to the consumer, there's more awareness and that hey, do I really need this and do I want this? And so
Absolutely.
there are reasons why some of these rules were put into effect.
Mhm.
But to answer your question clearly, a consumer and a patient should know what they're getting themselves into prior to receiving the healthcare services they're about to get.
Perfect, and thanks for sharing about the law change. That's good information for everyone to know because unless you've just recently experienced it, you may not know that.
That's right.
Let's talk a little bit about X gens and how they have aging parents, and now it becomes their responsibility to take care of them. What advice do you have for, again, the caregivers of that, and within the context of the changing insurance environment, and also like the advice on how to better provide the care, how to better prepare them to receive care at home?
So the question is complex. There's many questions within that last one, but let's start with, let me brief back the question. If I were a Gen Xer, which I am, what would I do to consider for my senior parents in preparation for choosing insurance or preparing myself for becoming age and maybe my final home or things like that? And so let's start with choosing an insurance. Medicare, when we turn 65 years of age, at least it is now today, it may change in the future where they push it to 68 years of age, hopefully not too soon, but nonetheless, when people turn 65 years of age, they have the opportunity to start receiving
Mhm.
Medicare, traditional Medicare. Then we all know that there are many, many private insurance plans that create Medicare Advantage plans that are out there for everybody. And so the challenges that we are faced with is, from my perspective, the best way to move forward is to always have traditional Medicare and a supplement to cover the 20% insurance that Medicare doesn't cover. And
Right.
the reason I say that is because access to care is not limited. The networks are unlimited. You can go see a specialist without seeing a primary care physician. If you're under an HMO Medicare Advantage plan, everything's directed through a primary care physician. Networks are more restrictive. Healthcare operators are more challenged with having to get authorization for services a little bit differently than with traditional Medicare. And so Medicare traditional, from a perspective of when you have many comorbidities or many diseases, congestive heart failure, hypertension, diabetes, all at one, if you have two or more, going to a Medicare Advantage plan may be a disadvantage in the future
Mhm.
for you because it tends to work better for the healthy senior that may be not wanting to pay a premium or needs transportation. But the minute you have to deal with complex, higher acuity healthcare issues, the Medicare Advantage becomes a little bit more of a limitation. Access to care, inpatient rehab becomes difficult to achieve. Skilled nursing facilities are difficult to approve. Home care services are more limited. And so choosing the right product for your parent is extremely important. Now, I understand the no premiums and the free transportation and many benefits Medicare Advantage plans provide us. It's extremely important to note that pre-existing conditions are never underwritten when you turn 65 years of age plus 6 months. Nobody can ever say we can't provide you insurance within that time frame. But after 65 years and 6 months, if you want to go back to Medicare traditional, you will be subjected to underwriting from any commercial plan for your supplemental insurance. And we all know that the older we get, the more diseases and illnesses we get, and who's not going to fail a pre-existing condition underwriting situation. So picking the right plan would be probably one of the most important things that I would tell a Gen Xer to consider. The other thing is making sure mom and dad are capable of paying their bills timely, getting their medications from the right place, moving from writing the old school checks for bills and putting them on automatic payments. I had a personal experience with a family member that forgot to write that old school check, didn't pay for their insurance premium, and actually lost their supplemental insurance with Medicare and had to be forced into a Medicare Advantage plan. And so situations like that can affect your parents. So Gen Xers need to be prepared. How much can mom and dad do at this point of their life and not be fooled that things can happen from one year to the next? We turn a blind eye to it and almost realize, wow, mom can't write that old school check anymore. So rather than be reactive to a situation, my suggestion is to be proactive and put those things in place, even though mom can write that old school check or dad can write that old school check today. Home environments are extremely important for Gen Xers to watch out with their parents. Watch out with those rugs everywhere, those falls
Yes.
risks, grab bars in the showers, being able to make sure you have the tape on the showers so mom and dad aren't slipping and they have that grab bar to hold on to. It's those unfortunate situations where you have a healthy mom and dad and they take a bad spill in the shower and things go south just from there. And so that's extremely important. And then lastly, being honest as a Gen Xer yourself, going to the willing and able rule. Am I willing is one thing, am I able is another thing.
Right.
Am I willing to take care of mom and dad? Am I able to take care of mom and dad? Some people aren't willing to take care of their parents because they just don't have the capacity or the patience to take care of mom and dad. And my relationship with mom and dad is better in a different capacity, and let me get somebody to care for mom and dad. The other part is, am I able to with my bandwidth in life? Am I too busy? Am I around? Am I even in the same city? And so being able to apply the willing and able rule to yourself and understand what you can and cannot do for your parents is extremely important.
Yes, it is. I know for a fact because I've lost my parents and had to go through that and make those choices and help, and they weren't here. So all the tips that you just talked about is exactly what I had to go through, and they're great tips, and most people don't think through them real clearly. So thank you for sharing that.
Absolutely.
Tell us what you love most about this industry.
Missy, I'd have to say making a difference in someone's life. If there's something that I love not only about my industry, but about being a father or being a human being is how did I make somebody's life different today or better today? Not different, but better. And how can we continue to do that for somebody? Um, Whether it's giving them a shoulder to cry on or actually getting them through a complex situation that otherwise they wouldn't be able to get through, making positive difference in people's lives is what I'm mostly connected to.
That's wonderful.
So what are the challenges in the industry that you're kind of working against to make people's lives better?
The industry's come a long way, and I'm in the industry, and by no means do I mean to beat up on my industry, but we've come a long way from a very fragmented system. You have a hospital system that has their own interest, a physician office that has their own interest, home care companies that have their own interest, and those interests are not aligned because of the reimbursements that exist out there. So we're less fragmented than we were before. Technology has enabled us to become less fragmented just in the communication part of things. Being able to, we discussed earlier, the coordination of care prior to discharge used to be a nightmare when I first started in this industry. It continues to be difficult. Hospital systems hire new people that we have to learn to work with that don't know who we are. And so all of it affects the overall transition and handoff of that patient going home. The transactional piece of the industry is probably my least favorite. Fighting
Right.
with insurance companies, to give the care that a patient needs is probably one of the most frustrating parts of my business. Or providing a service that's clearly medically necessary that may have not been documented correctly in a hospital system or in a physician office, and insurance companies leaning on that document to not pay an ancillary service bill like myself because of somebody else's documentation. Those are probably my least favorite part of my business.
How can patients and their caregivers better prepare to receive people from your company to come in and help them to get the caregivers? What are some things that you and your team run into when you're going to the home for the first time and they weren't expecting you, they weren't ready for you, and it ends up impacting everyone? How do they get prepared to see you?
I think that preparation lies on us to not necessarily hold their hand through the process, but being very intentional and making sure that
Mhm.
we cover every aspect of the transition. We're the ones that have seen it many times over. It would be unfair to put that on the patient themselves. But to answer your question, what can they do to prepare themselves is awareness of the benefits that are there under their insurance plan, being able to understand the plan description, being able to understand if there may be limitations in rehab and therapy, being able to prepare which home is best for mom. Mom doesn't necessarily have to go from hospital to mom's home. Maybe sister's home is better because sister may be there when the nurse gets there, and there's another person that could be a witness and apply the nudges that we can't apply when we're not there. Understand home care services is an intermittent service. We're not there 24/7. Having a willing and able family member available to us to provide that nudge, or maybe to do that little exercise that is beneficial for my total knee replacement and not wait for the H&TS therapist to show up in the home is good preparation. Having those resources available, excellent preparation.
I heard that one of the biggest issues in healthcare is people not taking their medications correctly or on time. So, what is your advice for the caregivers to ensure that they provide the medications correctly on time and that patients actually take them? Because apparently there's a lot of people that end up not wanting to take them. So, blows my mind, but apparently it happens a lot.
First point, you're absolutely correct. It doesn't matter how good a physician is, a hospital, a home care company. If a patient's not compliant with their medications and taking their medications as scheduled, there's not much we can do to help the individual. So medication management and taking them on time is extremely important. Where it gets confusing is patients go into hospital systems already taking 4, 5, and 6 medications for their conditions. Hospital removes all of those medications and says you stop taking them, provides you new medications or tells you to continue with certain medications, and the patient just wants to get home after discharge and doesn't go get the new medication. I have those medications in my home, and I don't need that other medication because that medication is the same thing of that medication, and last I know, they didn't get their medical school degree somewhere. And so it's extremely important that we listen to our physicians when they tell us that if there's a new med or stop taking this one and take that one, that we follow those instructions, because that's the number one reason for hospital readmission is medication noncompliance.
And that goes back to where can the family really help and be prepared? And that's to help the patient manage that, "No, no, you're not doing that no more," because it's habit, and so they have to help change that habit and being aware of it.
Habits and excuses are our biggest
Yes.
barriers, right?
Yes, sir.
And so you're correct. We are creatures of habits. And as we get elderly, we get even more stubborn and stuck in
Mm,
those habits. And so being mindful of that as family members to be prepared for that. And then the other component is that uh, having patients speak up that sometimes medications don't make us feel very good. And
mhm.
I think it's extremely important to just not stop taking a medication, but to communicate back to either our nurses or to your physician to say, doctor, this medication is giving me X symptoms and it doesn't make me feel good. We have a lot of patients just stop and not communicate, and that's the wrong thing to do.
Do your patients sometimes see you guys as doctors? Do they want doctor type care, and can they communicate with you? Can they just give you a call and get your services or hire you outside of the system? How does that work?
They would like for timely access to care for us to be the physicians and to not have to go to another party to get an order. But no, we are an extension of the physician's care. Patients are welcome to talk to us about anything and everything, and it is our duty to relay that information. We're an intermediary or an extension of the physician's care. And so we're there to take the information, get it back from the doctor, and then get the doctor to sign the order or maybe report unstable vital signs that may require a change in, let's just say, blood pressure medications, et cetera.
And I'm sure as the intermediary, you guys have a little bit easier time, getting information more quickly than sometimes the patient does because of that relationship.
Well, pretty much yes. There are some times we have those patients that get quicker attention from the physician than we can. And so, especially when it comes to making sure that something gets authorized or did my referral get there? And so, all of these transactional issues can affect the timely initiation of care. So, when there is a delay in that, boy, doctors tend to listen to their patients really well. But
Yes.
from a clinical standpoint, you're absolutely correct. Not only that, the fear of saying something that was not correct. And so we get to somewhat help the patients articulate properly to their physicians
Mhm.
what's going on.
Excellent.
I know insurance is a huge conversation. You kind of pointed out that it's critical to get the right one. Can you give us even like more detail about how someone can figure out what they need and when they need it? You mentioned something about 65 years and 6 months. The first thing that it sounded to me, it's like at 65 years and 5 months, I need to apply to the new, to get Medicaid. Um, might not be quite it. Like, give me a little bit about like the step by step that you would take someone to help them figure out what would be the best thing to do.
Well, I think simply calling out for either a trusted insurance broker, I myself can be called and discuss, and we become informed, get educated on what kind of plans are out there. Why is it better? You have artificial intelligence today and Chat GPT to be able to just plug in there. Imagine you're an insurance broker, expert insurance broker, and you want to advise me on my mom who's about to turn 65 years of age and has these conditions, and they give you some advice. I'm not saying take all of ChatGPT's advice, but become involved and don't just take things for granted or what someone tells you for granted. Unfortunately, we still have brokers that are reimbursed higher for driving patients to certain insurance companies or physician office that may have an internal relationship with United Healthcare or Blue Cross and Blue Shield, and they'll drive patients over to that product. We need to take responsibility for ourselves and not allow patients are great. I mean, physicians are great doctors, but not insurance brokers. And they're not going that, let's just say, for example, I go to my doctor's office. I can't get to my dialysis appointments. I don't have transportation. From the bottom of their heart, they recommend Medicare Advantage because Medicare Advantage provides free transportation, but never considers the fact of what happens next. And
Right.
so being in charge of knowing and educating ourselves on the insurance coverages that exists out there for us is extremely important, and not rely just on an insurance broker or a physician office trying to push us in a certain direction.
So it sounds like there are some conflicts of interest that could be occurring, and that's why it's so critical that people take it into their own hands. And it seems like it is a matter of life and death, or a huge expense if you don't get this right.
That's correct. And there's so many things that must be considered. You have transportation, you have premium, you have medications, you have so many things to consider and make sure that all of those variables have been considered and not just rely on, oh, I don't have to pay premium, let me go with a Medicare Advantage. Oh, I don't have comorbidities, let me go for Medicare Advantage, because we have to prepare ourselves of what can happen in the future. And so that underwriting piece, you'd be surprised that I told you this. You mentioned the 65 years plus 6 months. Not many people know it. Uh, I know politicians in Congress are being pushed for adequate disclosure to patients that when they are going to be pushed into a Medicare Advantage plan, that they may be subjected to underwriting in the future if wanting to move to traditional Medicare insurance. There are other events that you can flip-flop without any underwriting, and that's at the end stage of life. So when you have end-stage renal disease, or your doctor says you have 6 months left to live, or a diagnosis with 6 months left to live, and if you're on a Medicare Advantage plan, Medicare Advantage goes away, and you are now put back on traditional Medicare automatically. And hospice companies are 100% reimbursed by Medicare traditional and not the Medicare Advantage plan. So the system is very complex, and we can go hours and hours discussing it. But my biggest suggestion is get out there and educate yourself and understand what's out there. And it's not just for our senior parents. It's for what we're provided from our organizations as benefits. And so sometimes we're limited. This is the group benefit, and you get what you get. But we need to be aware of what we have. Too often we have a benefit that we're paying out of pocket small premiums for and don't realize that we're losing out on a benefit that the insurance company is providing, like a 100% wellness check, and we never go. So taking advantage of what we're already paying for is extremely important for the consumer.
I think there's two things that I think is really important. Um, One, ask questions, ask questions, ask questions. Two, get out that policy and read it. Don't just rely upon what someone tells you. I know just listening to you here today, my husband turned 65 this year. He's already getting all these things. And I just learned a whole lot of questions I'm going to have a discussion with him about and pull out that ruler and start reading.
That's great to hear. And I'm sure in your industry, Missy, you see a lot of people signing off on mortgages and new homes, and they just don't read everything, and
Right.
encouraging them to make sure that they understand. And you guys do a great job going through those paragraphs with them, explaining what they're
Mhm.
signing. And this document is for X, and this document is for Y. But we do our disservice to ourselves not combing through these documents ourselves.
Correct.
And it's okay to not know, because what you just said, ask questions and more questions and more questions. You read something you don't understand, the only way you'll ever learn it is to ask the question and be more curious.
Right.
Not losing that curiosity is extremely important.
Absolutely.
I would love to hear. I know that there's probably a lot of stories in the relationships that get built between the the caregivers, from HNTS and the patients. Do you have a story that comes to mind about how close they get, and how much value you end up adding, that there's a friendship or a relationship built?
We do, especially when it comes to these post-surgical procedures that maybe a other family member has gone through. Uh, there's always a question: can you bring me back X therapist or Y nurse? And they're always requesting back. And some of our Google reviews that we read as well is refreshing to hear that people that are within the profession, whether it's a physician or a nurse, and I've been a nurse for 52 years, And I think you're a standout company. Those kinds of that kind of feedback is amazing to us. Having somebody request a specific therapist is wonderful feedback for that clinician or for that therapist. It's what provides us with the fuel to keep doing what we do and forgetting about that transaction or forgetting about the challenges of the industry.
Is there something we didn't cover you would like us to ask you?
Well, I can say that there's a lot more that I can talk about,
Mhm.
and maybe in a part two of this podcast that I can take back and think about what are other items that somebody may not know today. Like you mentioned to me, there's a lot that I just learned in this
Mhm.
conversation that I'm going to take home to my husband. There's a lot more of that, Missy, and that this brief conversation doesn't do it justice. But off the top of my head, I can't think of something right now.
I do have a question about that, though. Do you go into some of those things on your website?
We do, and it's more broad-based type services, specialty programs that we have, and so we have programs like medication management, Step Safely, renal programs, total joint replacement programs. So it's more geared towards that, and so when someone is wanting to understand this is what my mom or my dad needs, they can go to our website and see some of the
Okay, I'm gonna
services that we
ask you that.
provide from the complexities of health insurance and patient
Mhm.
advocacy. uh, you're bringing up a great idea that we probably need to add a lot more of that information in there.
Q&A.
More importantly, probably some links and resources to
Mhm.
feel like it's not coming from just a home care company. It's coming from a company that's been in business since 1982
Mhm.
or a gentleman for 33 years of experience, but also pointing to uh, um, resources that you could substantiate the evidence for and
Right.
support for.
Mhm. Eduardo, I go in homes all the time, and I have a lot of elderly clients' homes that I've gone into, and it's always interesting for me, especially when they're moving because there's been falls or, issues that come from aging in place, and, they need to go to a place that is a lot more conducive to them living, without having accidents. I'm sure in your business, you guys go into many homes and see all kinds of things that could definitely be improved. I know we talked about grab bars before, and that's an excellent suggestion. But I'm sure there's other things you all have seen that you just said, "Man, I wish they would have thought about this." Can you tell me some of those?
Yeah, there's plenty of them actually. We have people that their heart is in the home that they've lived in all of their lives, and maybe they're as we age, we still have the connection to our home where we grew up in, but maybe we need to transition into what does that final home look like. So
Mhm.
when you have clients that are considering their final home, steps into the house, steps anywhere in the house, tubs are a no-no when it comes to seniors aging in place, because having to step over that tub is an opportunity to have a major fall. And so walk-in showers are extremely important. And then you get into new custom builds where let me give you an example where you may have even a younger couple that is interested in making sure that they build out a
Mm.
mother-in-law suite. There's pre-wiring and technology where you can set already pre-wiring for motion sensors. Today in our home care world, we have technology that we can put into existing homes that can tell if mom or dad are having more frequent wake ups and going to the bathroom, for example, in the middle of the night, that could indicate a urinary tract infection. And so there's different things for ongoing monitoring that we can prepare ourselves for. Doors that may not be wide enough, people with walkers, And so making sure that the spaces are wide enough. We mentioned throw rugs and things that aren't necessarily part of the home, but people like putting throw rugs out, and I understand why, but they become a falls hazard for people. Um, and then overall, stepping stones. I know that people going into the back and doing their gardening, they've done it all of their lives. They accidentally miss the stepping stone, step on one of those rock pavers, and there goes an ankle and a fall. And so those kinds of things. From a preventative standpoint, the technology is there, but from an ongoing aging in place standpoint, the steps, the showers, the wide doors, the creating a safe environment are probably the most important pieces I would recommend.
I have a question. Do insurance companies cover home improvements at all?
So just like in provider assistance services and when I told you the bathing and the grooming and the feeding, for whatever reason, our Texas Medicaid does pay for home modifications up to a certain amount. So if somebody has Medicaid, we can do an outdoor ramp, or we can put in a roll-in shower and do home modifications. But for anybody that is not Medicaid eligible, unfortunately, those are out-of-pocket expenses that come from the consumer.
That's amazing. I bet you most people don't know that.
Yep,
A
there.
really good researcher might, but most people don't know that their insurance might cover that.
That's right. And so if you have Texas Medicaid, there's ways that you can approve. And through our company, we can not only provide the help with the assistance of daily living, the bathing, the grooming, the
Mhm.
feeding, the shopping, but we can also have somebody come in to do home modifications and get those kinds of things approved with the state of Texas.
That's awesome. Awesome news. Thank you for sharing that.
Sure.
Let's get a little bit more into that. How does somebody know if they can qualify or what they can get or what they need?
It's on a needs basis, and so if our therapist is in there, or the usually the way Medicaid works is there's a caseworker assigned to them from the state of Texas that
Mhm.
does a full assessment of the home, that will tell a company like ours, based on my assessment, your mom or your dad can benefit from 20 hours of service from HNTS for provider assistance services, or 40 hours, but most of the time they land anywhere between 20 and 30 hours a week of what they'll provide. And then they'll say, I see that you're wheelchair bound and you have steps going in. I'll also make a determination to approve home modifications for your home. And so if the state caseworker misses it, our social workers and staff will catch those kinds of things and then bring it up to the caseworker. And that's where the caseworker will do a reevaluation and approve those services, those home modifications.
And can someone seek one of these caseworkers? How do I start the process of, hey, someone come take a look at my situation?
There's a number that we can provide them that they could call the state of Texas and inquire about them themselves, but we're allowed. You could call HNTS and refer your own family member to services, and we can help and advocate and start the process along with the family. And then the family just needs to be prepared that when the state does follow up with them, that conversation has taken place between the family and the caseworker themselves. And then at that point, the patient still has a choice. Even if they called us for the referral, caseworker goes out and does the assessment, there's still a choice to pick, because that caseworker will probably provide them with a list of 20 home care companies that they can utilize, and they would have to pick from one of those. And it's our hope that they pick us.
Let's say I'm in the market and I'm looking for someone to have in-home care. Why do I want to choose HNTS?
I think it's pretty simple. We have the tenure. We've been practicing since 1982, which puts us at almost 43 years. My personal experience of 33 years. It's not the first time that we've done it. We've experienced 4 different reimbursement systems, an evolution of healthcare insurances and healthcare reform, thousands and thousands and thousands of patients served. Mistakes have been made, and we've learned from those mistakes. And you want to pick a company that has the experience in these kinds of events and situations. And the easiest reason and the most important reason to pick HNTS is because of our 10-year experience. Outside of the experience and tenure and expertise, we're from San Antonio. I'm from San Antonio. I'm committed to the city. I'm committed to making and improving the city for everyone. You can pick up the phone and call the CEO in my organization. Other organizations are hard to get to. Owners are from different parts of the country. And so those are the two major reasons why. And one, I think we're the best.
I like that.
Another reason why I think HNTS is the choice for you is because from a clinical standpoint, all of our nurses and therapists aren't just picked straight out of school. We force every one of our clinicians to have at least a minimum of 2 years experience in the grind of a hospital system under a surgical floor or post-surgical floor where things can get pretty exciting. They're in the hospital, they have the ability to ask one of their colleagues for help. In the home, they don't. They're on their own. And so our clinicians not only have been trained in hospital systems or in ICUs, then they go through rigorous training with us within all our specialty programs. They've been trained by manufacturers of IV products. They've been trained by renal doctors. We have doctors that are medical directors that educate our clinicians, ongoing training and education. And so when you're getting the service in the home, you're getting it from highly experienced clinicians, not only compassionate clinicians, but highly experienced and trained clinicians that are going to do great work. We're highly experienced in complex wound care. We know that it's not just about treating wound cares or diabetic ulcers on people's skin. We know the importance of nutrition, how nutrition affects the healing of a wound. And so you're not just getting a wound care nurse. And so the expertise and the tenure of having to work in an acute care center or a hospital center prior to coming to work for HNTS has our team highly skilled and highly trained.
That's what I call a perfect package. It takes it all. It takes the experience, the know-how. It's not a startup. You're local, and you have amazing, well-trained, well-educated people. Why would I not hire you?
That's correct. And that is our hope. And thank you for that.
How can people get a hold of you?
So you can get a hold of us by calling at 210-822-8807. Our website is www.hnts.org. And either one of those places has instructions on how to contact us. Another simple way to contact us is simply tell your doctor or the hospital discharge planner that's seeing you in your hospital room to say, can I select HNTS or can you call HNTS? We will come and see you at your bedside prior to discharge and introduce ourselves as an organization so you feel comfortable that when you are discharged, you already know who's coming into your home.
So tell us a little bit about what myths and misconceptions do you see in the marketplace out there about patient care in the home?
I think the number one misconception is that, my friend got home health. Why can't I get home health? And there are some preliminary requirements that qualify you to receive home care service. And one is you need to have a skill need. So coming out of a hospital system, obviously you'll have a skill need. You'll need to be homebound. And homebound doesn't necessarily mean homebound, I will never be able to leave my home. Homebound means it is a taxing effort for me to leave my home. And then the other piece is you need a certifying physician. You can't just elect, I want home care services. Your physician or the hospital discharge planner, usually by supervision of a hospitalist in the hospital, which is a doctor, will order home care services. So the misconception of, I just want home care because I think my mom and dad need home care is one misconception. The other, call it a myth, call it a misconception, is I need to go to inpatient rehab following post-surgical care, post-knee replacement care, and that is a misconception or a myth. You can be released from a hospital to receive therapy services, post-surgical joint replacement in the home if you choose to. Now, it may be unsafe, and the clinical team, the doctor, your family made the decision that inpatient rehab would be better suited for you. But sometimes the level of service can be a misconception. And so always ask, is home health care an option for me? And when you're talking to your providers and talking about the plans, is we're going to send you to an inpatient rehab. Is home care an option for me? And so that would be something that I would bring up.
Great. Another question I have is who shouldn't, definitely shouldn't have home care?
The Definitely the ones that are not homebound, the ones that can care for themselves. There's a motto from an organization by the name of Cops Metro, and one of their values and mottos is don't do for others for what they can do for themselves. And so those are the people that can care for themselves, that are stable, that don't need the benefit or that don't require home care, shouldn't receive home care. On the flip side, patients that are extremely sick, that need a higher level of care, shouldn't opt for, let me just get a nurse in my home to take care of it, because that's a potential setup for failure as well.
Well, and again, you guys aren't there 24/7 either.
That's right. We're an
Mhm.
intermittent care. And so there's a graduating step. What may not be prudent as home care for the next step following a surgical knee replacement, and let's just say 2 weeks of inpatient rehab and then home care. So it's just a matter of understanding the situation, the home environment. The other piece is I think it's extremely important that you said who shouldn't. Let's talk about the ones that should, that choose not to. And I think that's extremely important because we have a lot of cases like that where people are just sick and tired of having a clinician in front of them, number one. And so the thought of, oh my gosh, I'm leaving the hospital and now somebody's coming to my home. That's the wrong reason not to say, I don't want home care. Or my home is too messy and they're going to see my home, and we don't care about the messiness of people's home, or we don't judge on the fact that somebody didn't wash their dinner dishes the night before. We may make recommendations for the health and safety of the patient about cleanliness of a home, but to be embarrassed about the condition of your home just is not the reason to neglect home care. And so we have a lot of patients. We have more patients that choose not to receive home care because of those reasons. And I think those are the wrong reasons, because you're just going to be a frequent flyer into that hospital. You're going to be going in and out of that hospital, and things are just never going to get better.
Those are some very good points.
Thank you.
I'm just wondering if there's some people that have other reasons. They might be embarrassed of having people in their home, or feel like, they might get judged by the type or size or something about their home, or who's there, or they feel that there might be too many people there or not enough people there, or maybe they have pets. Are there some other like reasons why people decide not to take the care, and they just need to like recognize that it's okay?
There are many reasons that outside of the messy home and that you're embarrassed about your home. You could be have an aggressive dog. All of these things is a simple communication where we can mitigate the risk of maybe an aggressive dog, putting the dog outside when our clinicians come over. They're family members where grandma's been there and they have all the kids in there and they don't want to see all the kids and the friends in the home. And in the end, the priority for a clinical outcome and a health outcome is much more important than the ego getting in the way of the home being either messy or full of children or a aggressive dog, or simply, I just don't want another clinician. All we are doing is creating barriers to what we're trying to achieve, and that is the ability to care for yourself in an independent fashion outside of clinical intervention. And if we delay things with I'm embarrassed about my home, or I just don't want to see another clinician, or I have too many children in the home, or I don't like their friends, or I have an aggressive dog, is an avoidance to an end that must be met and will never be met if we don't address it.
Well, Eduardo, we have learned so much about the importance of your business and how you all help us as an individual when we need patient care in our home. But we've also learned today amazing questions to ask. We've heard some great information about getting our home ready for the patient coming home. We've heard some great information on insurance, which I'm sure a lot of people didn't know. It has been such a pleasure to interview to you today, and I can't say thank you enough for spending time with me.
Well, thank you, Missy. I wish you the best of luck in your business. And there's so much more when it comes to healthcare. I'm happy to come back any given time to discuss in more detail or at more granular level anything within the healthcare industry. I'm happy to help and serve.